You're watching the Fox 5 Morning News.
Hey, welcome back. Look, the kids are here. Say hi, kids. Oh, I love the smiles. Okay, no matter what grade your child is about to enter, there's a lot of things you have to prepare for as a parent. The back-to-school checklist, the to-do list. With us this morning, Dr. Chaffoo from Scripps Hospital with yearly medical exams. Every single time, doctor, this is very important. I don't know that a lot of parents know that they should do this, but it's a good reminder, correct?
It is, definitely.
Okay, the first one you say is, this is something that is important, your family-centered medical home. Explain what this means.
Sure, so Raoul, what it is, essentially, it's somewhere where your child gets their care on a regular basis, somewhere consistent, where they know their health information, they've got phone numbers, contact information, and they have long-term care.
That's important, and then keep it all in one place so everybody knows where to go.
Yes.
And you don't have to run around the house trying to find things at the last, almost like an emergency kit of sorts of information, everything else. Next, the dreaded shots.
Right. I know. So
Talk to me. How do
Sure. So I think it's more traumatic, obviously, for parents.
Yes,
I've got 6 kids, and they're all get through the vaccinations. But the important thing is, of course, to get the vaccinations that are now, of course, required by California state law. And each year they change it. It's very confusing for parents. One of the best places to go, Raoul, is the American Academy of Pediatrics website. Because we've got changes in terms of chicken pox. Now there's flu, there's Hep B, and some of the other vaccinations that'll keep current.
Okay, the young athlete, a lot of people starting off in middle school and high school, they're going into athletics, they're going into sports. So what kind of prevention, I guess, some exams that you need to get done?
Not just the regular physical examination, Raoul, but there's actually a sports examination, because the important thing is that you want to make sure that your athlete, your student athlete, at least 6 weeks before they start a sport, they get in, because there may be some preventative treatments. And if they've had an injury, which, by the way, most injuries are occurred due to overuse, you want to make sure that that child's gotten proper care and they've recovered from that injury before their sports activity starts.
What specific types of exam, because the physical, obviously the thorough physical exam, it's not just the sport-specific exam, but what kind of, how often, at what age? There's so much to worry about.
There is. So at least at the age of kindergarten or before kindergarten,
that
a lot of
early?
schools, yes, are requiring physical examinations. And the interesting thing about a physical examination is that it's probably the only time that the child is going to get to see their doctor on a regular basis. So that once a year, they check back in with their pediatrician.
And in terms of information for the school, how do you communicate with the school if your child perhaps has a health problem? Make the school aware, the teacher, the nurse?
So a lot of times the nurse or the school secretary will have an email address. Many of these forms are on the school's website.
And more so today than ever, there's easier ways to communicate, either via text messages or emails with parents if something happens to that child at school.
Absolutely.
And getting that communication is so important. Okay, I'm told there's some sort of quiz. Doctor, I'm not usually good at the quizzes ever since I left school, but do you ask me these questions now? It's also things for parents to know and parents to do. Do you want me to ask, or should I ask?
So,
and then you kind of.
One of the questions would be, how many hours of sleep do children need?
How many hours of sleep do children need? Okay. So we have options here. Oh, look, the sleep mask.
I know. So obviously, children that are very young, Raoul, anywhere from about 3 to 6 years of age, require at least 11 to 12 hours of sleep a day.
Really?
Once a kid gets into school, anywhere from 6 up to the age of about 12, they need about 10 or 11 hours of sleep. And once they
get
to
at 12, you still have 10 or 11?
Really? Now, once a child gets to be about 12 or 13 to 18, they need at least 8 to 9 hours of sleep. But as we know, a lot of kids aren't getting an adequate amount of sleep, and that's part of the reason why they're not doing so well in school, is sleep deprivation.
What about the 40-year-old child? How much?
As much as we can get.
Because I'm only getting about 6.5 this child. Anyway, okay, here's another question. Does it matter what kind of breakfast kids eat? To that I will say, well, of course it does.
Yes, it does.
And it's important. You know what I used to do when I was a kid? I would go to school, I didn't have breakfast.
Right, and a very important meal for kids. I loved Captain Crunch. In fact, they did an interesting study that just came out from Tufts. They compared memory for kids that had these really high cereals, like sugar cereals, like Captain Crunch, and oatmeal, and they found that those that had oatmeal actually did better on memory tests.
Okay, I want to show the kids again, because 2 more important questions. The best shoes for kids to wear, closed-toe shoes or flip-flops? I vote closed-toe.
You're right.
Yeah.
Closed-toe are much better for several reasons. One is for safety, but remember, the closed-toe shoes are the ones that have ankle and arch support, which helps with your spine and reduces the chance of getting stress factors.
Sure.
The problem with the open-toed is they can injure you can get injuries. Plus, they've found that commonly you can find thousands of bacteria on your family flip-flops, some of which are Staph aureus. So besides stress fractures, plantar fasciitis is another problem because there's no sole support.
My goodness. Okay, we got to go, but quickly, the heaviest backpack, that's a big deal because now you see a lot of kids with the rolly backpacks, and that's a good strategy, but the limit, the heaviest a backpack
10 to
should...
15% of the body weight, according to the American Academy of Orthopedic Surgeons.
Dr. Chaffoo, we thank you. Obviously, the rolly backpack's the way to go.
Way to go,
right?
definitely.
All right, Doctor, thank you very much. We
Good to see
appreciate
you,
it.
Raoul. Thank you.
Look at this. I like this thing over here. Look at that. There you go. That's E for education.